to sell quick.
Veterans are at higher risk of lung cancer, and there's an urgent need for awareness, advanced care, and early detection. Dr. Drew Moghanaki, UCLA lung specialist, cancer specialist, joins us along with Jim Pantelas, Navy veteran and 18-year lung cancer survivor. Thank you both so much for joining me here today. Jim, we'll get to your story here in just a minute, but I want to talk to you, Doctor, first about the Veterans Administration helping an estimated 1.5 million veterans enrolled in VA healthcare that meet the lung cancer screening criteria. So is VA able to reach all of those veterans successfully?
Absolutely. VA currently takes care of half of our veterans, providing health care services for them. And of those 9 million veterans, 1.5 million of them are estimated to be at risk for lung cancer. And what that means isn't that 1.5 million veterans are going to get lung cancer. It's just that that's who we need to be carefully screening. And we need to be screening our veterans because of their exposures to chemicals, to asbestos, to Agent Orange if they served in Vietnam. And of course, a lot of veterans smoked when they were in the service. And then a lot of our veterans after discharge work in industries where they continue to be exposed to chemicals that can cause lung cancer. And so VA is fully committed and has the resources to reach all of these veterans, whether we can screen them at the VA with an annual chest CT, or if we have to purchase that care in the community, we can definitely take care of all those veterans.
And what can you tell us about a veteran's experience once they enroll in a lung screening program?
Yeah, so our veterans basically lay on a table and they slide in and out of a CT scanner for just a few seconds. The whole thing altogether takes just about 2 minutes. That's what we're asking for. And during those 2 minutes, we get a three-dimensional image picture of the lungs to find out what is going on inside, how is the health of the lungs, and if there's a tumor in there. Lung cancers don't grow really all that fast. We do have a window, but we have to be doing these screens every year to catch it before the lung tumors grow beyond the lungs and become much more difficult to manage.
And Jim, let's get you into this conversation as a veteran and as 17-year lung cancer survivor. Tell us a little bit of your story, if you would.
Yeah, I was diagnosed in 2005 with a late-stage lung cancer. When we say late stage, it was stage 3B, and it had metastasized outside of the lung. So what I ended up with as treatment options were surgery, chemo, and radiation. But that's 2005's version of surgery, chemo, and radiation. So the surgery was much more invasive. The chemo was pretty harsh, and the radiation was far less targeted than the treatments that are available today. It was also caught at a late stage, so had I been in today's world, I would have probably gotten diagnosed a couple of years earlier when the treatment options would be far less invasive. We're pushing for early screening so that far less invasive, far less drastic measures are required to deal with the lung cancer.
Well, and along with this, I mean, getting a cancer diagnosis is hard enough as it is, but dealing with, say, feelings of guilt. We mentioned smoking, and if a service member smoked, they may feel guilty, or maybe that getting lung cancer was their fault. What would you advise someone who is going through those thoughts?
Lung cancer is the result of breathing. You're breathing in toxins all over the place. And for military members, that can include burn pits in the Middle East. It can include Agent Orange in Vietnam. It can include all kinds of toxins. So while many of us smoked, myself included, it's not just smoking. And no one deserves lung cancer. So I would just tell them that if you have lungs, you can get lung cancer. If you increase the risk factors, get screened.
So important to be proactive. Like you said, that screening is so essential. And doctor, you know, Jim's mentioning how medicine has changed. There's something called precision medicine now that is just much more accurate. What can you tell us about that?
Yeah, in addition to lung screening, and there are millions of people in this country who should be getting screened, not just veterans, and we're not screening enough people, and only 8% of eligible people are getting screened. Those who get screened will diagnose these tumors when they're smaller and better treatments, and part of that better treatment has resulted because of precision medicine. So what does that mean? That means that we take the cancer and we send it to a special lab to request what's called biomarker testing. Biomarker testing has helped us understand that there isn't just one or two types of lung cancer. There are dozens and dozens of types of lung cancer, and the biomarker test result tells us what that is so we can get the right drug for them. And when we match the best drug to each of these subtypes of tumors, we're seeing much better outcomes than before. And sometimes those treatments don't require chemotherapy, or if they do, they are enhanced with immunotherapy and targeted therapy, some of which are a pill. And this allows the treatments to be safer, better tolerated, and ultimately helping our patients live better and longer lives than ever before. The face of lung cancer has definitely changed, and it's no longer a uniform death sentence.
Of course, and you recommend clinical trials as well, right?
Absolutely. We're here because of past participants in clinical trials, like Jim himself, who was a trial participant, and the data that we gather from clinical studies helps us keep moving forward. Look, there's a lot of promising treatments out there, but you need to study it on a clinical trial to know whether it's better or not, and we just keep stepping forward into the future where we will get to a day where no one ever dies of lung cancer ever again.
And I know we can go to screenavet.org. There's just so much we could discuss about this. I know we're just scratching the surface, but Doctor, thanks for your insight, and Jim, for your service and for sharing your story with us today.
Thank you so much.
Thank you.
For the millions of Americans